Getting a NEET PG seat is a dream for many. Many PG aspirants work so hard to get a PG seat and get a better career and a best life. Then why are these PG residents being treated as a cheap labor in many medical colleges and government hospitals? You heard me right. PGs in many government and private medical colleges are made to work like anything that their mental health and physical health is being affected so badly. This video is for all the PG residents. Those PG residents who have worked hard to get into the PG but still suffering in your medical colleges. You have to know certain rules about your working hours, about your leaves as well. So in this video, I am going to tell you about what NMC rules are saying about your leaves, about your working hours, and how you can fight it if you feel your college management is making you work more than the stipulated working hours. So watch it till the very end. Don't miss anything. This is Dr. JTM, MD General Medicine and a part-time YouTuber, and I welcome you to my channel Dr. JTM. Generally in any sector, the job holders, the maximum working hours will be 48 hours per week with Saturday and Sunday off. But how many of you job holders and common people know that this 48 hours of work is being done in just 2 days by the PG residents in most of the government hospitals and private colleges? Yeah, you heard it right. The 48 hours straight continuous duty is being done by many of the PG residents. They will only have minimal sleep and minimal food, and they'll get 8 hours of break, and again they have to come and continue their 12-hour shift of duty. Just imagine how much work these PGs are doing. Can a human really sustain this kind of life? Very common practice in most of the medical colleges is that most of the PGs will be getting 36 hours of straight duty without any break, and they will only be getting 15 days of leave per year. Am I right, PG residents who are watching this video? If I'm not wrong, this is how your rosters are being given to you and you are working according to it. But let me tell you what these NMC rules are saying. In 2023, NMC have released certain rules and regulations for all the PG residents for your working hours and leaves as well. Before, it used to be 74 hours per week of duty should be done, but later on NMC in 2023 have changed it to 48 hours per week with 1 day off in that week, and the working hours in a day should not exceed more than 12 hours. And when it comes to leaves, every PG resident has 20 leaves, 20 paid leaves in a year, and at the same time 5 academic leaves can be allotted. But these leaves should not be taken at a stretch, maximum 5 per month only. When it comes to the maternity leaves, it is as per the government rules, that is up to 90 days of maternity leave can be taken, but by submitting a permission letter from your HOD and college to the university. Any PG who crosses this number of leaves and puts any extra leaves, it will go into the extension of your work duties. You have to complete all your extension duties in order to get your completion certificate as well as MD/MS degree. This is what NMC rules and regulations are saying. But my question is that how many colleges are following these rules and regulations? My question to PG residents, you tell me how many of your colleges are following these rules and regulations. Comment down, I wanted to know. According to a survey done in 2025 January, only 14% of medical colleges in India are following these NMC 2023 guidelines. Till date, 62% of the PG residents in the entire India are doing 74 hours per week duties with at least 36 hours duty at a stretch. Yes, 36 hours at a stretch duties, 3 in a month. More than 70% of the PG residents are not getting any day off or any week off, at least minimum leaves in their PG tenure. This is how our system is working, and many PGs are falling sick, spoiling their physical and mental health. But at what costs? 86% of the PG residents in India are having one or the other health issues. Female PG residents are having health problems like anemia, hypothyroidism, PCOD, obesity. When it comes to male PGs, they are suffering from excessive hair fall, back pain, obesity. It is clearly evident that 3/4 of PG residents have mental stress, physical exhaustion, lack of sleep, and emotionally drained. Residents are burnt out due to this unreal working hours. Nobody talks about this issue. Actually, this is not an issue for any of the college managements, and NMC doesn't even bother about this. NMC itself have done a survey and published that 31% of the PG residents are having thoughts in their 3 years of PG tenure, and 28% of the PG residents are having one or the other mental health issues and they are suffering it even after completing their PG. A career should actually build your personality, not suck your life out of it. PG residents do not talk about it. Actually, they can't talk about it. If they raise their voice, they will get threats from their management that they will fail them in the exams or they will detain them in the practical exams. HODs keep on targeting these particular PGs who raise their voice. Their life will become more horrible. Many incidents are happening where PG residents are suffering. I can't really show you images or videos according to this YouTube guidelines. None of the incidents have really come into limelight and nobody have really taken them seriously. And one more thing, recently AIMS have passed a particular circular or a notice regarding these working hours for the PG residents, and everybody are applauding them that AIMS have done the best thing and all. And what is that particular circular is about? They said 48 hours per week duty should be given for PGs, 1 day off in a week, and not more than 12 hours duty in a particular day. Bro, are you seriously release that circular? It's just a copy paste from the NMC guidelines from 2023. But now you are making it a thing because many AIMS PG residents are suffering and many internal things are happening. You wanted to sugarcoat all of that. But the question is, do the AIMS really follow it? If they follow it, for how many months they can follow it? What about the other medical colleges in the country, and what about all the universities which are not even following the rules and regulations of NMC that are commanded or given in 2023? Only thing PG residents can do is that they have to write a written complaint and give it to the college management. Obviously they won't take it seriously, but you can write a written complaint to your university, but I don't know how risky that is. But you can also write the same letter to the NMC by mailing it to NMC by all the residents who are present in that particular college or in that particular state. Then NMC will take care of things. But before NMC could react, it takes months and months time for you to get that problem solved. And lastly, you can file a case in Supreme Court under Article 21, violation of fundamental right to live with dignity. But PG residents do not have that much time to fight. They only have to study, complete the work, and get out of this university getting a degree. That's how their mindset is, and they are not wrong at all. Student associations like FIMA and IMA should actually be on the student side and the PG resident side and put this pressure on the NMC and universities, on medical colleges to follow these particular rules and regulations for the working hours for PG residents. Otherwise, in the upcoming days, we have to see more and more incidents that are going to happen among the PG residents. And you PGs and you medical fraternity who are watching this video, what do you think of these unreal working hours for PGs? And what do you think that should change in this particular rules so that PG resident won't be burdened or stressed with this so much of work? Just let me know in the comments below, and if you love this content, please do like, share and subscribe to the channel, and I'll be coming with one more great video of great content. And this is Dr. JT signing off.